Thank you to our committee members for their presentation. We'll now begin taking questions. So if you're in the room, please step up to an aisle microphone. If you are watching the webcast, you can submit your questions in the text box that's next to the webcast viewer. So let me just, to get the discussion going, you talked about different actors that can play a role in helping prevent bullying. So what should schools specifically be doing to prevent bullying and the harm it causes?
I can start off a little bit about that, and I know Sandra has a lot of experience in this area as well. I think one area is increasing awareness of the prevalence of bullying. The research that's summarized in the report indicates that staff generally underestimate the number of youth that are involved in bullying and think it's not as much of a problem as the kids do within the building. So we think collecting local data from individual schools, be surveys or other supports, that can really open their eyes to how significant this concern is within the building. Talking about the problem of bullying and sharing evidence-based approaches, perhaps adopting one of the evidence-based models that includes professional development for the staff about how to detect bullying and effectively intervene, using perhaps a curriculum within the classroom that helps youth know how to identify bullying and develop skills to reduce their likelihood of engaging in bullying and coping with bullying when it occurs, communicating with parents about what to do when they become aware of bullying, and fostering a more positive school climate and engagement among all youth, so that way there's a sense of equity and inclusiveness among the students within the school environment.
So a couple of things to add to that, so I fundamentally believe, and I think the report supports this, that kids get picked on because they're perceived as different, and you can be different along a number of dimensions. It's up to the schools to be doing more proactive efforts to teach tolerance for kids who are different from you, and this is independent of the concern about bullying. We're in an increasingly racially and ethnically diverse country, and we need to be able to learn to live and accept and get along with people who are different from us. So teaching tolerance, I think, is one thing schools need to be doing a lot more of. And secondly, the bullies are often very popular, and we have a section in our report which distinguishes the type of bully who has a lot of negative consequences, negative psychological and academic consequences down the line, who's rejected and disliked. But there are a lot of kids who bully to maintain their popularity and their social status. So schools need to be addressing that. And this is a value issue too. Why is it that kids who bully others are so popular and emulated and widely accepted by such a large proportion of the peer group? I think if we can teach tolerance and bring kids greater awareness to, let's not support kids who bully others and value that kind of popularity, that those are two concrete steps that we need to be doing, in addition to implementing the research-based, evidence-based practices and programs that Catherine summarized.
We have a question from the web.
This is a question from the web from Stacy Ford. It says, as a tutor through our local authority for high-risk youth and youth with disabilities, too many times I encounter bullying of a student by a teacher. Also, too many times when a student tells a teacher about bullying from a peer, the teacher does not address the issue or disciplines the victim and not the perpetrator. Was this covered in the report, and what is the suggested approach to address this type of bullying?
Given that we use the definition by the CDC of bullying, and that would include, that focused us more narrowly on youth-to-youth forms of bullying, we did not address issues related to adults bullying youth.
But we did talk a little bit, there's not enough of a literature on this, on the fact that kids don't come to the teachers, often because they don't think the teachers are going to actually help them. So I think this is part of training and consciousness raising amongst teachers that not to think of bullying as this normative process and kids need to work this out themselves, and be learning concrete strategies to actually help kids who are picked on, so that kids feel the confidence that they can turn to the adults in their school environment when they do encounter such experiences. So yes, I think the report did address teacher beliefs and teacher likelihood or willingness or belief that they should come to the aid of the targets.
So what should parents know about this report and take away from it in terms of either supporting their child who might be bullied or dealing with their child who does the bullying?
Well, I think it's that parents, first of all, need to recognize that this is a common problem. And as a pediatrician, I see kids come into the clinic where the child may have various somatic complaints or may seem down and depressed. And I think that as a pediatrician and people as parents need to ask their child, is bullying happening to you? Is this happening to you? Is it happening online, or is it happening in school? So I think that's the first thing, is to recognize that it's happening. Secondly, it's to encourage their child to tell them if it is happening and tell their teacher that it's happening. I think third, the parents should contact the school and ask the school what are they going to do about it, and try to be proactive with their school in developing programs that really try to prevent bullying from happening. And finally, if their child really does have a lot of consequences from the bullying, somatic symptoms or depression, for the parent to seek appropriate help for their child.
Another issue that's important here is the modeling that parents do for their children when the child reports bullying to them. Unfortunately, in some family circumstances, the parents might blame the child for their behavior and suggest that they did something to become a target of the bullying. That's a very important issue for us to clarify to parents, that we should not stigmatize children just because they've been victimized, and it's quite likely a very complex situation that led to this, and we want to make sure that we're not blaming the victim in that. We also want to make sure that we are teaching tolerance and promoting nonviolent responses to bullying. There's a growing body of literature around parents encouraging their kids to fight back or hit back, but the literature suggests that that's not an effective way of resolving bullying, and parents should not recommend hitting back. Some parents might think that worked for them, but generally speaking, that is not an effective strategy for reducing bullying, and parents should instead talk about other kinds of strategies that their kids can use to avoid the situations, non-aggressive ways of de-escalating it, and reaching out for additional help from the school.
So I just want to say a couple of things about these vulnerable groups, and I hope that the word gets out that there are kids. It doesn't mean that every kid who's LGB or every kid with a disability or has a set of intersectional identities is going to be bullied in school. But if these youth are more at risk, parents need to know that. They know often whether their kids are members of these vulnerable groups, and parents need to be confident enough to be proactive, to advocate on behalf of their kids in schools, and be particularly vigilant. If you're a member of a vulnerable group, then parents need to know about it, and they need to have the skills to advocate on behalf of their children in the school context.
We have a question in the room.
Yeah, hi. My name is Michael Liu. I'm the director of the Maternal Child Health Bureau, which provides some support for this work. And so let me just start by thanking you for the important work that you did, and also just kudos to you, especially to Dr. Rivera, for your leadership. So I have a two-part question. First, whether the report provided any specific recommendations around cyberbullying. And then second, whether the report provides specific recommendations for healthcare providers. Thank you.
With regard to cyberbullying, as we had discussed, that's a rapidly changing venue for aggression and bullying to occur. And so it's a little bit tough for the researchers to keep up with technology in some areas. But there are some new and innovative models that are using anything from video gaming and other strategies to help kids interact more positively with each other online. Some of the social network sites also have strategies to report bullying when it's happening or other kind of inappropriate behavior, so that leverages technology in that venue. So there have been some studies that we recently reviewed in the report and summarized there, but it's an area that we certainly need to have more attention to. In fact, many of the bullying prevention programs touch on cyberbullying but don't address it quite as intensely as they probably should, and sometimes don't even actually assess that particular form as an outcome. Schools struggle a little bit with the issue of cyberbullying because it is, from their perspective, contemplating is it a school issue or not, but most school policies indicate that if it's causing a disruption in the school environment, it becomes a problem. And because of the thin membrane between the online environment and the school environment, it certainly is causing a greater disruption. So it's an area where there are some emerging technologies that are available to help us report and track cyberbullying, and some models that are proving to be potentially promising in that area.
Thank you, first of all, for being a leader in funding this report and the workshop that preceded it. I think it was really at the behest of HRSA and the Maternal Child Health Bureau that this all came about, so thank you for that. In terms of healthcare providers, I think that we need to do a better job of educating them, and there's one of the 7 recommendations that's specifically talking about education of individuals who come into contact with children and having them be better informed about how to deal with children who are bullied. I think it fits into the overall context of Joe and I, or Joe, Dr. Wright here is a chair of pediatrics at Howard. We do a great job of teaching our residents to take care of a 600-gram premature infant, but we don't do a terribly good job of teaching them how to take care of an adolescent who's bullied or depressed. And so I think we need to really do a better job of that.
We have another question from the web.
This question is from Mary, and she's asking, does the report deal solely with school-based bullying, or is there any reference to bullying outside of school, or in particular cyberbullying, and how parents can deal with this type of bullying?
Yeah. We certainly cover the topic of cyberbullying, as I had just described in response to the previous question, that can occur at school and cause a problem at school. There is bullying that happens on non-school grounds, the bus, the community, and that certainly was addressed within the report as well. We did not focus on siblings, for example, because that was not consistent with the CDC's definition that was employed for the report. But there's such a large co-occurrence with these different forms of bullying that we think that our report does have clear implications for bullying that might occur in other contexts well beyond the school. I focused in our summary here today, because of limited time, where we have the strongest research base, and it's around the school-based prevention programming. We certainly summarize other literature within the report and have some really nice tables that highlight the different ecological contexts where these models can be implemented. And even if they are delivered through the school from a prevention perspective, they can involve families and community members that get well into many of those other ecological levels that Sandra talked about.
And I think we clearly state in the report that, in the final recommendation 7, that the social media companies need to step up to the plate and develop policies related to bullying and to monitor their success.
And there's a whole chapter on policy implications and impact of policies, many of which are broader than just the school environment.
Bob Hauser, the Academies. My childhood was quite a while ago, but my recollection is that the big issues in the vulnerability in bullying really had to do with older kids versus younger kids, bigger kids versus smaller kids, and not so much with the kinds of social categories that you've discussed. And I just wonder if that kind of traditional bullying relationship is covered in the report.
Well, you're talking about a critical part of a definition of bullying, which is the imbalance of power. And there, historically, when Olveus and others were first articulating the dimensions of bullying, which made it different from peer conflict, for example, and it was imbalance, and it could be thought of as older kids picking on younger kids, bigger kids picking on smaller kids. But there are other ways to think about an imbalance of power also. So for example, if you're the numerical racial ethnic majority in your school and you're compared to the numerical racial ethnic minority, we know that you're more likely to be vulnerable to victimization if you're the minority, if you're the numerical minority. So that's another way of understanding and thinking about an imbalance of power. There are these social imbalances, and much of what guides and motivates and are the goals of bullies in our contemporary world are the need to maintain that high social status. So there are multiple ways I think that we need to be thinking about an imbalance of power in addition to the more traditional ways that we've thought about it.
Another possible imbalance of power could be a tech-savvy kid that knows how to use technology to cyberbully somebody else. So that didn't really exist when we were coming along, but it does now, and that's a whole other dimension of power and control that can be leveraged in today's society that wasn't around when we were growing up.
We have a few minutes left. Another question from in the room.
Yeah, hi, I'm Donna Rotero-Stern. I'm the founder of the JMP project, J Not Plain. You talk about teaching tolerance regarding bullying. I heard in the report you also mentioned self-esteem or a low self-esteem, which would be an unhealthy lack of self-esteem. Is the report directing the teachings to our schools healthy self-esteem, and instead of tolerance, but teaching a strength of an inner awesome, or the child to have its own inner strength to then, combat the bullying? Is that going to be addressed, or has it been addressed?
Well, I don't think we address that. That's a great question. For me, tolerance is a person perception issue. How do I view other people? So if I want to teach tolerance, I need to be teaching people, kids, adults, to have more positive, supportive, less prejudiced or stereotyped attitudes towards other people. That's teaching tolerance. But at the same time, you're absolutely correct. The targets of historically of the bias or the bullying, they also need to be learning and acquiring and developing skills that are of self-efficacy and feeling good about yourself and feeling that, my fate is in my own hands. So I think it's dual. I don't think it's all just changing the stigmatized individual or groups that we need to be teaching and training our kids to be more tolerant towards other people.
Thank you.
We have time for one more question from the web.
This question is from June. It says, considering the recommendations made for federal agencies, what are the next steps? How can the public get involved to help promote further support?
Well, we make some very clear recommendations to federal agencies in the report in terms of using a consistent definition, doing surveillance. For example, the surveillance slides that Catherine showed are the only national surveillance that's been done. We have very little information about, on the national level, of bullying of these special vulnerable groups: LGBT kids, youth kids, children with obesity, children with various disabilities such as autism. The federal government needs to sponsor more research on what are the most effective programs and looking at their effects upon these different vulnerable groups. They need to sponsor research that looks at the biological and psychosocial consequences, the immediate ones and the long-term ones, on the effects of bullying on youth. There's also a role for local governments to have effective policies in their school districts that make sure that bullying programs are in place in the schools, and those programs be based upon evidence. And I think for parents, it's being involved with their PTAs and their communities to make sure that these schools do have appropriate bullying policies, that they're not simply resorting to zero tolerance and not having effective programs that are going to prevent bullying in their schools.
So with that, we will conclude our public briefing. I would like to offer a special thanks to the committee members who joined us today. As you heard, they were representing the diverse expertise of the entire committee that wrote the report. And as a reminder, you can download the report and related materials at www.nap.edu/scienceonbullying. Thanks again.